The economic performance of the cattle industry is strongly influenced by the percentage of cows and heifers calving each year. The main objective for both beef and dairy units is 1 calf per cow per year, irrespective of whether they are intensive or extensive production systems. On well-managed farms, the objective is to have the animals pregnant as soon as possible and, because of technical reasons, preferably in a period best suited to the management system used. Crucial to this objective is the relatively short time after calving in which a cow has to become pregnant again. The objective 1 calf per cow per year amounts to a calving interval of 365 days, of which 280 days need to be subtracted for gestation, plus the 45 days needed for the involution of the uterus after pregnancy. This leaves only 40 days in which the animal has to become pregnant again. During these 40 days, the animal is fertile 2 or 3 times at the most. As this is a very short time, both management and individual disorders of the animals need close attention. Only then will it be possible to reach the objective of 1 calf per cow per year. Every disorder of the reproductive system of the cow leads to prolongation of the calving interval, as does unnoticed estrus or insemination at the wrong time. In this program, we'll pay attention to those aspects of management that play important roles in reproduction in the cows: estrus detection, estrus control, and estrus synchronization. In order to be able to explain the problems and their solutions or therapies, we'll first give a short description of the sexual cycle of the cow. The sexual cycle is controlled by harmonious combined action between the nervous system, a number of organs, and different hormones. These are the most important organs and hormones. First, the hypothalamus, situated at the base of the brain. Here, gonadotrophin-releasing hormone, named GnRH for short, is produced. As GnRH stimulates the production and release of the hormones LH and FSH, it may be considered to be the conductor of the whole process. The hypophysis, or pituitary gland, produces both FSH and LH under influence of GnRH. FSH, or follicle-stimulating hormone, stimulates the development of follicles in the ovaries. LH, or luteinizing hormone, is responsible for the last phase of ripening of the follicles, ovulation, the release of the ovum from the follicle, and for the development and maintenance of the corpus luteum in the ovary. The follicle, containing the ovum, produces estradiol. This is the estrus or heat hormone. It induces the behavior and the physical symptoms which make it obvious that an animal is ready to conceive. After ovulation, a corpus luteum develops from the remnants of the follicle. The corpus luteum produces progesterone, which suppresses the release of GnRH and therefore also suppresses the release of FSH and LH. This prevents new ovulations. Progesterone also has an influence on the mucous membrane of the uterus, preparing it to receive an embryo. If the cow is not pregnant 16 days after estrus, the uterus produces prostaglandin F2 alpha. This hormone causes regression of the corpus luteum with a lowering of progesterone levels, enabling a new sexual cycle to start. In the following description of the sexual cycle, these organs and hormones will be discussed again, one by one and in relation to each other. The sexual cycle of the cow is not generally dependent on the season of the year. Estrus, or heat, is seen every 20 to 21 days on average. The day of estrus, or heat, is called day 0 in the cycle. In the ovaries of a non-pregnant cow, follicles continuously develop under the influence of the FSH produced in the pituitary gland. FSH release is controlled by GnRH produced in the hypothalamus. These are follicles in an ovary. An ovum is enclosed in a follicle. The ovum lies embedded in the inner cell layer of the follicle. One of these small follicles will finally develop into a ripe follicle that will ovulate. This follicle is called the dominant follicle. During the final stage of the ripening process, the follicle produces estradiol, causing the cow to come into estrus, or heat. Heat is the signal that the cow is ready to conceive by natural mating or by artificial insemination. Through the hypothalamus, estradiol also stimulates the pituitary gland to increase its production of LH. The so-called pre-ovulatory LH peak initiates ovulation, which usually follows 24 hours later. Ovulation is the release of an ovum by the bursting of a ripe follicle. The ovum is caught by the fringe at the end of the oviduct. These are live pictures of ovulation, and here the ovum is transported through the oviduct to the uterus. During this transport through the oviduct, the ovum can be fertilized. Here you can see semen on its way into the oviduct. These are pictures of fertilization, the union of an ovum and a sperm cell. The period of follicle development, estrus and ovulation, which is characterized by the production of estradiol, is called the follicular phase. After ovulation, the remnants of the follicle undergo important changes under the influence of LH, which is still being produced by the pituitary gland. The corpus luteum develops from the inner cell layer of the follicle. This is what a mature corpus luteum looks like in reality. The corpus luteum produces progesterone. Progesterone inhibits the production and release of GnRH by the hypothalamus, which in turn reduces the release of LH by the pituitary gland. This prevents new ovulations. Progesterone also influences the mucous membrane of the uterus, enabling an embryo to embed, thus maintaining pregnancy. These pictures show very clearly the first divisions of the embryo and the embedding of the embryo in the uterus. The part of the cycle characterized by the presence of a corpus luteum and the production of progesterone is called the luteal phase. If the animal is not pregnant, the uterus releases prostaglandin F2 alpha around about day 16 of the cycle. This hormone is responsible for the regression of the corpus luteum. When the corpus luteum regresses, progesterone levels in the blood will decrease. As a result, the release of GnRH is no longer inhibited. That means that a new follicular phase will start, allowing a new dominant follicle to develop. The cow will therefore come in heat 4 to 5 days later, and the sexual cycle will start again. The best moment for insemination of a cow is at the end of estrus, up to 6 hours after estrus. When insemination is successful and the ovum is fertilized, the process continues as follows. The embryo arrives in the uterus around day 5. There, the embryo gives signals of pregnancy, amongst others by producing BTP, bovine trophoblast protein. BTP prevents the uterus releasing prostaglandin F2 alpha, and as a result, the corpus luteum stays intact. The progesterone produced by the corpus luteum inhibits the production of GnRH, and through this, it inhibits the production of estradiol for the rest of gestation. In this way, pregnancy is maintained. The development of the embryo can be followed by echography or ultrasound. From this brief outline of reproduction, it can be concluded that the correct timing of mating or artificial insemination is of critical importance for optimum breeding results in cattle. Good heat detection is therefore very important, as is the use of good quality semen. Heat detection will be discussed in detail in the next part of this program. Now we'll pay some attention to the semen quality. A bull produces 2 to 6 milliliters of semen at each ejaculation. The average number of sperm cells is 800 million per milliliter and varies between 500 and 2,000 million sperm cells per milliliter. The number of sperm cells in the semen and the degree of motility can be established under the microscope. The semen is also evaluated for appearance, colour, and for the presence of abnormalities such as blood and pus. Investigations like this are done at AI stations, but testing the semen quality of bulls is also very important on farms using their own bulls. A normal sperm cell consists of a head with an acrosome, a neck, a midpiece, and a tail. The genetic material, the chromosomes, are stored inside the head. The vibrating action of the tail enables the sperm cell to move forward. Sperm cells in undiluted semen show mass activity. The movement of individual sperm cells in a straight line forward must be satisfactory. A large number of abnormalities of the different parts of sperm cells are recognized. Usually these abnormalities originate from the time the sperm cell is developing. Good quality semen does not contain more than 10 to 15% of abnormal sperm. With the aid of certain coloring techniques, it's possible to count the number of living, dead, normal and abnormal sperm cells. Deep frozen and thawed semen samples need additional testing. The survival percentage should be at least around 40% after thawing, and the number of good live sperm cells should amount to at least 6 to 8 million per insemination dose. Heat detection is essential in the management of animal reproduction. However, on average, farmers only detect 60% of heats. A healthy bull would score 95 to 100% depending on the number of cattle he is running with and the conditions under which he is kept. As the heat lasts a relatively short time, from 4 to 20 hours, it is important to know the estrus signs very well and to spend sufficient time observing the animals closely. The most important signs of heat are: the animal shows changed and restless behavior. Mainly in the beginning, the animal tries to mount other animals. The animal shows a standing reflex when it's mounted by another animal. This reflex is the clearest and most important sign of heat. Other signs of heat are signs on the tail head of the animal that it has been mounted by others. Clear mucus discharge coming from the vulva. For proper observation of these signs, it's necessary to spend enough time observing the animals and at the right moment. Many studies have demonstrated that the ideal is to check the animals 3 times daily for 15 to 20 minutes each time. As heat occurs more frequently at night or during the early morning hours, the animals should be checked early in the morning, at noon, and late in the evening. A good identification system is necessary to be able to recognize the individual animals. Good record keeping also helps to check the animals and to predict the heats. As has been said before, on average, 40% of the animals in heat are not detected by the farmer. Besides this, on extensive farms, it may be impossible to carry out correct heat detection for practical reasons. Even with high conception rates, inadequate heat detection may lead to failure in achieving the objective of 1 calf per cow per year. Nowadays, excellent methods for estrus control are available, making it possible to inseminate the animals at the right moment. One method is based on promoting early regression of the corpus luteum by using prosolvin, a prostaglandin F2 alpha preparation. A second method is to artificially prolong the luteal phase by using Crestar, a preparation containing progestogens, imitating a corpus luteum. The second method can be used both in cyclic animals and in animals that have ovaries with no or little activity. The most important reasons for controlling estrus are inducing estrus in cows that were not seen in estrus within 60 days after calving to reduce the calving interval. Synchronization of groups of yearlings to be inseminated with semen from bulls selected for high genetic gain and ease of calving. Synchronization of animals for use in embryo transplantation programs. On extensive cattle farms wanting to use artificial insemination, synchronization may well be the only solution. As we have seen in the description of the sexual cycle, prostaglandin F2-alpha induces luteolysis, the regression of the corpus luteum. Prosolvin consists of an effective prostaglandin F2-alpha analog named luprostiol. So, by using prosolvin, regression of the corpus luteum can be induced, thus ending the luteal phase of the sexual cycle. This also means that prosolvin can only be used for estrus control in cyclic animals, animals with active ovaries. The corpus luteum needs to be in a certain stage of maturity before it can react to prostaglandins. It is sensitive to prostaglandins from day 5 or 6 of the cycle onwards. So, luteolysis can be induced by prosolvin treatment between day 5 and day 15 of the cycle. After day 15, natural regression of the corpus luteum will occur. After injection, the corpus luteum regresses and a new follicular phase starts. The animal will come into heat 2 to 3 days later and can be inseminated. When an animal is treated before day 5 of the cycle, a normal corpus luteum will develop. These animals will require a second injection 11 to 12 days after the first injection, when a mature corpus luteum will be present. The animal can be mated or inseminated at observed heat. Blind insemination can be performed at 72 and 96 hours after the second injection. When synchronization of a group of animals is desired, one should realize that not all animals will be in the sensitive stage of the cycle. In order to achieve good synchronization, 2 injections with an 11 to 12 day interval should be given. Then the animals can be inseminated at detected heat or blindly. Blind insemination, used mostly for yearlings, should be carried out 72 and 96 hours after the second injection. Adult dairy cattle show a somewhat different reaction to prostaglandin injection. The interval between injection and heat is influenced by the day of the cycle on which the injection is given, and also differs from animal to animal. This variation is even more obvious after 2 injections. For this reason, it's better to inseminate adult dairy cattle only at detected heat. In beef cattle, it's common for a large number of heifers and adult animals to be in anestrus, meaning that there is no cyclic activity in the ovaries. This is seen especially in suckler cows and in animals in suboptimum condition. animals in anestrus do not have a corpus luteum, and therefore they will not react to a prosolvin injection. These animals can be treated with Crestar. The use of artificial insemination with semen from tested bulls offers the farmer a number of advantages. Better quality calves, fewer calving problems, and the possibility of reducing the number of bulls on the farm. The use of artificial insemination makes estrus detection necessary, especially on extensive farms with large numbers of cattle. This may present problems because daily observation is often not possible. Besides that, beef cows nursing their calves frequently have no cyclic activity or show only weak heat symptoms. In order to be able to induce heat in both cyclic and non-cyclic animals, Crestar can be used. Crestar prolongs or imitates the luteal phase by means of a synthetic progestogen. Estrus and ovulation can be induced in both cyclic and non-cyclic animals without having to first assess ovarian activity. Crestar gives a very accurate estrus induction and is therefore well suited for estrus synchronization. Treated animals may be inseminated once at a fixed time, making heat detection unnecessary. The Crestar method consists of an implant and an injection. The implant is placed in the ear, and at the same time the injection is administered. The Crestar implant contains norgestomet, a synthetic progestogen, which acts in the same way as progesterone produced by the corpus luteum. It prevents new ovulations. As has been said before, Crestar acts like an artificial corpus luteum, and in particular inhibits the pre-ovulatory LH peak, thus preventing new ovulations. The injection makes it possible to limit the duration of treatment to 9 to 10 days, which is necessary for a good fertility. When the Crestar implant is removed after 10 days, an LH peak will follow, inducing an ovulation. In animals with inactive ovaries, the Crestar implant makes the hormonal system more sensitive, just like natural progesterone would do. To obtain an optimum effect, it's necessary to inject PMSG at the time of removal of the implant. PMSG has a strong FSH activity, stimulating the development of follicles. It's important to give a correct dose of PMSG, as an overdose can result in twins or triplets, and too small a dose has insufficient effect. Depending on breed and age, treated animals can be inseminated once, blindly, 48 or 56 hours after removal of the implant. Because of the differences in treatment between dairy and beef cattle, 4 different optimum methods have been developed, as is shown in this outline. As inactive ovaries are seen quite often in beef cattle, PMSG should be administered after removal of the implant in both yearling and adult animals. As dairy yearlings are usually cyclic at the moment of treatment, they generally don't need PMSG. For adult dairy cattle, the recommendation is to administer prosolvin 2 days before the removal of the implant and PMSG at removal to obtain optimum synchronization. Treating animals in this way makes it possible to perform one single insemination without heat detection. Although you have seen the Crestar implant being placed and removed during this program, we want to give you some more detailed instructions. Always handle the animals as quietly as possible. Make sure that the head is well restrained in order to prevent unexpected movements during the implantation. The site of implantation in the ear should be disinfected in advance. Using the clean needle of the applicator, an implant is taken from the packing in this way. The implant should be sited in the outside of the ear flap, between the skin and the cartilage. It should not be placed too close to the base of the ear, but halfway along the ear. Avoid damaging the cartilage and the blood vessels. Once the needle is pushed in completely, the implant is pushed out of the needle while removing the applicator at the same time. Check to see whether the implant is in place and, if necessary, squeeze it into place. Administer the Crestar injection intramuscularly, preferably in the neck, immediately after placing the implant. It goes without saying that before using the applicator's needle again, it must be disinfected first. The implant is removed after 9 to 10 days. To do this, a small incision in the middle or at the end of the implant should be made, allowing it to be squeezed out. During the previous parts of this program, we have discussed the problems that may be encountered in the management of reproduction of dairy and beef cattle, and we've proposed solutions for these problems. Estrus detection, estrus control, and estrus synchronization. These were all discussed, but, as you may well be aware, other reproduction problems may arise. The most important problems are uterine disorders, like acute postpartum endometritis, chronic endometritis, and pyometra. Ovarian disorders, like cystic ovaries and nymphomania, and so-called repeat breeders. Intervet International is the only specialized veterinary pharmaceutical company producing all the necessary high-quality therapeutics needed for the improvement of fertility and reproduction in cattle. These products all contribute to achieving the objective, one calf per cow per year, anywhere in the world.